It's an honor to be here and to be part of the Monmouth Medical Center Southern Campus family. I've spent my first days at Southern Campus learning about the outstanding work our physicians and staff do every day to care for our community. In the coming months and years, I look forward to meeting and getting to know all of you in the community. Dr. Vozos and I would like to thank our sponsors and contributors for their continued generosity by supporting Monmouth Medical Center Southern Campus. Your support is awe-inspiring and is so critical to our success. Tonight's program will support our amazing cancer programs that make a difference for so many who need our care. I hope you find the tour of our hospital enlightening and it may inspire you to support us. Thank you again for being our partner in health. Before we start our virtual tour, let's hear a few words from the chairman of our foundation, Mr. Robert Sickle.
Thanks, Eric. Hi, I'm Rob. I'm the chairman of the Monmouth Medical Center Southern Campus Foundation Board and the owner of Pine Belt Cars. The Monmouth Medical Center Southern Campus Foundation's mission is to strengthen the financial security and future of the medical center through supporting programs and services and providing state-of-the-art equipment and technology, while extending into our communities through education and outreach. Our success and impact is a direct result of the incredible generosity of our donors, trustees, and community. Your investment will help us stay on the cutting edge of clinical care and remain a strong healthcare resource within the community. I invite you to sit back and relax as we get a glimpse into some of the remarkable departments here at Monmouth South. Thank you and enjoy your evening.
Hi, I'm Sarah Manning, and I'm the Director of Outpatient Infusion. I'm very excited to be with you to tell you about the wonderful team that we have. You can get chemotherapy anywhere. All drugs are available at any facility. What's different about the infusion unit at Monmouth South are the people. When you're undergoing chemotherapy, it's the worst time in your life generally. And the nurses that we have at Monmouth South are impeccable in the way that they help people get through that time. Everything that they do 100% with heart and give everything that they have to every single patient we have. Cancer should be personal, cancer care should be personal, and that's what we deliver. Our unit is unique compared to other ones. We don't have the one large room where you have many people sitting around in the circle. We have private and semi-private rooms. So it really allows the patient and the patient support person to have that time to ask questions without feeling uncomfortable. Over the last 5 years, we've seen huge growth in oncology specifically. Where we used to see maybe 1 or 2 oncology patients a day, we're averaging about 20 to 25. I don't think there's any one reason why people are coming here. Certainly you can just simply say, well, their physician is referring them here, but it's not so much why they're coming here, it's why they're staying here.
So here you have the circumflex.
Hi, I'm Adam. I'm the Director of Radiology at Monmouth Medical Center Southern Campus. Here in radiology, we have state-of-the-art equipment and top-of-the-line full diagnostic suite is our newest addition to the radiology department is our Siemens GoTop. It's been a great addition to the radiology department. This piece of equipment has artificial intelligence within it, and it does a virtual cardiac catheterization. It does not require any catheters going through the groin or any invasive procedures. There's only 7 sites within the state of New Jersey that does it. We have seen an increase in volume thanks to our marketing campaigns and the word getting out for this particular piece of technology. We were able to get a lot of the cardiologists to start sending their patients that were high risk of infection to do this virtually. What motivates me most of all is to try to make a difference within the field of radiology, to really take it to the next level as far as educating the technologists, the staff, as well as educating our community about some of the things that we can do preventatively and post-procedurally.
My name is Ray Duarte. I'm the Regional Director of Monmouth Medical Center Southern Campus and also Monmouth Medical Center Long Branch. I've been biking literally an average of about 120 miles a week, and that's consistent, except for I was seeing a chiropractor for my back pain.
Monmouth Medical Center Southern Campus is fortunate, and the community that we serve is fortunate, I think, to get the latest technology, which is called FFRCT, or Fractional Flow Reserve CAT scan. So it is essentially a CAT scan, and then we use artificial intelligence software to analyze the images that we get on the CAT scan to give us a more definitive diagnosis of the blockages in the blood vessels supplying the heart.
During the implementation, we needed to test the system to ensure that everything is working before we go live.
We needed volunteers, but we did not just need random volunteers. Ray was one of the folks who volunteered himself because he was having some upper back pain on exertion while he went biking.
I went in to get my CT done, and the following day he called me up. He said, "Ray, I have good news and I have bad news."
When I told him, it's fantastic images of your heart blood vessels, but unfortunately I have to give you bad news as well, which is you do have a blockage, a severe blockage, upwards of 90%. And then he went on to have a stent and fix that blockage.
Lo and behold, right after my procedure, I realized that the back pain that I had prior to my procedure is gone. And what Dr. Mohan had told me, he said, "Ray, that's your indication, that's your symptom that you're having, heart problem."
When you have a significant benefit on another person's life and well-being, there's no feeling like it. That is why we all go to medical school. That is why we all go into the healthcare profession. There's no higher calling in my mind than to make a benefit in a patient's life and well-being.
Having the CT FFR heart flow technology elevates this hospital to be on top of its game. It'll put a lot of value to our patient in this community to have this technology and be able to diagnose their condition in an accurate, non-invasive way. This technology literally saved my life.
Hi, I'm Jerry Smith. I'm the Administrative Director of Periop Services, Patient Care. I oversee the operating room here at Monmouth Medical Center Southern Campus. We have grown over the past 2 years approximately 30%. Our surgical volume increases in our specialty areas such as general surgery, urology, orthopedic, vascular surgery, and ENT. We do approximately over 300 cases a month, and we're 24/7. Patient satisfaction is something we're really proud of. We have received exemplary awards over the past few years. We educate the patient prior to coming into surgery. We give them the facts and what to expect. When they do come in, they are seen by the registered nurse who calls them ahead of time. Upon discharge, that nurse calls them within 24 hours. So there is a strong connection between the patient and the registered nurse. I have a fantastic team. They're made up of nurses, techs, transport, clerical support. It really takes a village to build what we have down here in Southern Campus. I have a passion for what I do. I love taking care of the patients that we serve in our community. I love being a part of a team. We are a family, and we want to do the best. We come in every day giving 110%.
Hi, my name is Dee Yard. I'm the Assistant Director of the Jacqueline M. Wilentz Breast Care Center. We are a full comprehensive breast care center, so that means you could come in, have your screening, mammo, your diagnostic mammo, all the way up to having surgery. The best thing about my department is that we have state-of-the-art equipment. We have 2 3D hologic mammo machines, we have a 3D hologic stereotactic machine, and we have ultrasound machine as well. In our department, our radiologists are dedicated. We have an all-female staff. They're very caring. They just go out of their way to make the patient feel comfortable. We like to listen to the patient, feel out their needs and their concerns. We like to tell the patient what we are going to do during the exam so there's no surprises. We go above and beyond with our patients. We try to put ourselves in the patient's shoes. We grew tremendously in 1 year, so to facilitate that need, we had to add on an extra 3D mammo unit, which has been wonderful. So at this time, we can offer more services to the community. My aunt had breast cancer, so this is very personal to me. If I can save a woman's life from doing 4 pictures of her breast, then it's well worth it for me. I just want to go out there and save lives. That's my devotion, my passion, and my drive.
Hi, I'm Nancy Stevens. I'm a breast cancer survivor. I had a routine mammography last November, and I went there secure in the fact that I was going to be okay, because there's no cancer in my family, so it wasn't going to happen to me. And I came home that day, and they called me back for an ultrasound, and I was shocked. I went back, and sure enough, they found a lump. So I went home, didn't know what to do. So I called Robert Wood Johnson the next morning, and everybody there was immediately so nice and understanding, and they were very helpful. And they suggested Dr. Schulman, so I called him, went there, and I found him to be kind and considerate and not hurried, easy to talk to.
I told her the pros and cons of potential harms for whatever we do. We always discuss that, and she felt very comfortable with having a lumpectomy.
I have a pulmonary lung condition where my breathing is compromised, and so they did a non-invasive surgery. And that just was perfect for my condition, and I got through that without a problem.
Nancy's case, when you look at the total person, her age, her overall health, and her underlying lung problems, the fact that she had a very early cancer, biologically not aggressive, it was felt that a lumpectomy, that was all that was necessary, as well as post-operative endocrine treatment, that we didn't have to do a sampling of the lymph nodes.
I was delighted to get the treatment close to home. It just made it easier on everybody, and I just found that everybody was so competent and so kind and understanding and just efficient. It was just wonderful that it was close to home.
Monmouth Medical Center Southern Campus has a history of providing excellent care for their patients, and even just as importantly, in a caring, individualized type of atmosphere. We look at the patient as a whole, and we try to do the best thing, for the patient based on whatever their problem is. In this case, it was a lady with breast cancer.
Dr. Schulman, he made me feel just very comfortable. He's a very lovely man.
I love working here, and I love taking care of my patients at this institution.
Hello, my name is Jennifer Lees. I'm the Director of Emergency Services at Monmouth Medical Center Southern Campus. At our emergency department, we realize that everybody's time is important. So we utilize pull to full, which means that as long as there's beds available in our department, our patients come right back. Because as much as we know that we're great providers, we're great nurses, we're great techs, the patients didn't come here to see us, they came here to see the physician. So the sooner we can get them back into those beds and to get the assessment by the physician, the sooner we can get them on to the next level of care. Our door-to-doc times run less than 8 minutes, and that's our wow factor. We're also very proud of our department because we do sustain the highest patient satisfaction in the RWJBarnabas health system and also nationally. We work collaboratively with all team members from all departments that service our patients. We have a very simple philosophy in our department. Every single person who touches our patients is just as important as the next. So whether you're the housekeeper or the CNO, we all have the accountability to make sure that our patients have the best experience. The way that our team works together, our patients feel that. It's tangible. And I believe that that's the reason why we do have such great patient satisfaction scores and also our employee engagement scores. Just because we are one of the highest in the system doesn't mean we should stop there. We want to make sure that we're nationally recognized and that our patients feel that satisfaction. It's not just a number on a piece of paper, it's what the patients feel. And we want them to come back. We want to be the healthcare provider of choice for our patients.
Hi, my name is Michael Skloff, and I am the director of the James and Sharon Maida Geriatrics Institute. Our program is a one-of-a-kind, state-of-the-art program where we see patients 65 and older, inpatient and outpatient. Our program is considered one-stop shopping. The seniors come in and they first meet with our nurse. From there, the geriatrician or nurse practitioner comes in and assesses the patient. If those providers feel the patient needs more services like blood work, EKG, echocardiograms, or radiology services, our lab and radiology departments can come upstairs to our exam rooms and take care of those patients while they're with us in their exam rooms. We are affiliated with the GEM unit, Geriatrics Emergency Medicine, which is located downstairs in our hospital's emergency department. If that patient then is admitted into our hospital system, they will be admitted to our ACE unit, which stands for our Acute Care for the Elderly. And the beauty of it is that our geriatrician and our nurse practitioners can go to those inpatient rooms and see how they're doing if they are our patients. We have a social worker. Our social worker conducts 2 different types of support groups. One of them is a caregiver support group. We also have a bereavement group for those who have lost their spouses. Along with all of these services, we also have a physical therapy department. Finally, with our program, we know that a lot of seniors don't have transportation. We offer a complimentary van service. Where else do you get this kind of service? Nowhere, except here. So we're quite pleased and quite proud. We make a difference. We do make a difference, and I'd like to say we hold hands. We do. We hold hands with our patients, and when they call, we answer.
Geriatric Institute, Chris speaking. May I help you?
Special thanks to all our sponsors, for without them, none of this would have been possible. We are forever grateful. We hope you enjoyed this new and creative way of keeping in touch and staying connected together. Philanthropy was always nice to have, but in today's environment, it's imperative to have. This will ensure that we can keep the hospital updated with the brightest talent, the most up-to-date technology that will help us continue to provide you and your family with the very best healthcare right here in your community. During these unprecedented times, we ask you to consider making a contribution. All proceeds will support cancer services here at Monmouth South, so we can continue to provide the best clinical care, cutting-edge therapies, and state-of-the-art technologies to you close to home. On behalf of our entire leadership team here at Monmouth South, we would like to share our sincere thanks for your participation and support.